Welcome to the Drama's Way podcast. I am your host and producer, Liz Church. In our latest introduction to the Dramatist team, to the Dramatist Way, we're doing something a little different for this episode. And to shine a light on this month's awareness, and while October is the declaration for many different awarenesses, it is also known as Down Syndrome Awareness Month. As quoted by the National Down Syndrome Society, it's a month to raise awareness and celebrate the many abilities of our loved ones with Down syndrome. This is a time to continue to break down barriers and focus on promoting advocacy for people with Down syndrome. And we're doing the same in our episode with Dee Cates. She is a Dramatist's bid and proposal coordinator, but she's also a devoted mom to a child with Down syndrome. And with her permission, I had the pleasure of talking to her about their lives, the challenges that they've faced, and how she's overcome them. So, without further ado, we shall begin. Hello!
Hello!
Let's go ahead and just start with talking about healthcare and Down syndrome and, what you discovered in your pregnancy with the benefits of early diagnosis and all the things that followed that.
Mm-hmm. I think early diagnosis was one of the things that helped me prepare the most. And I know that sometimes people are binary on this. They either really appreciate having access to early testing, and some people are just like, no, absolutely not. I don't want to know. And I think that's a personal choice. But for me and my situation, it really helped me to plan. I'm a researcher and a reader at heart. So I research and read everything, and just sort of having that time to sit with the understanding that things are going to be different than what you thought they might be. I don't think anybody goes into their pregnancy thinking about all of the things that may not be what they expect. I think some of that does cross your mind, but the statistics are more so that, everything's going to be perfectly normal and healthy. So I think when, confronted with that and you have the opportunity to do something like non-invasive prenatal testing,
Mm-hmm.
It's great. And, again, I think allowing me to be prepared and talk to people who had information. For instance, I met with a geneticist. I met with a maternal fetal medicine specialist. So that preparation was key for me. And then I felt like I could just really focus on, okay, here's the joyful part that a baby's coming, and trying to prepare my mind for being a parent, because I think that is in and of itself a huge job.
Yeah. And obviously when you are a parent, you have that moment of I have a little human that they're relying on me for the rest of my life. And that is a really scary thing to go through. And one thing that we were talking about, preparing for this, is that, there's only so many resources that you could have when you're becoming a parent. But then if you're becoming a parent with Down syndrome, there's a whole avenue of things you are really unprepared for. And if you don't ask the right questions, you feel like you're alone in this kind of instance. And when you were talking about having those questions and being prepared, that's that research, that going through the things that you were looking at. And one thing you had revealed to me is that many doctors still today, they're not fully educated on Down syndrome, and they see it as a bad thing. So they deliver it as bad news.
Yeah.
And it was that's really upsetting and disheartening, because that already puts the parent in a place in a position that they feel that they cannot do it, or they cannot do it right, or that there's something wrong in a way that really also pushes that stigma of what happens with children with Down syndrome, which is also it's a dishonor to children with Down syndrome, because it's just there's so many different types as well. And I
Yeah.
say so many because a lot of people just think generally it's, one type of syndrome. Could you go a
Mhm.
little bit into depth on that? Because you're the one that educated me on this, and then like I had to be like, all right, let me go look more on this.
Yeah, yeah. I mean, to your point about how the diagnosis is delivered, I think if there, is one thing that I could just really say to the medical community is to think about how that conversation um, may be perceived and like what parents are going to be internalizing as they get these diagnoses. And I was surprised when I went through this journey of being pregnant with my son at how much doctors didn't know. I think we kind
Hmm.
of regard doctors as, having so much authority, I think, in the medical space, notwithstanding the fact that there's so many specialties and they certainly don't know them all. But I think even it was surprising to me to, have to say things or like really advocate for things that I felt like, oh wow, I feel like you should know this and you don't.
Yeah.
Um, but underlining the conversation I think that specialists have in this, I can't tell you how many moms and dads that I've spoken to where a lot of the times the first question comes after the diagnosis is delivered is, do you want to continue this? And so, you have parents who are already like, they're processing this diagnosis. And then on top of that, it's layered on like, are you even sure that you want to have this child? And I think, it just stems from years and years of like people being in a space where they really either didn't know about a lot about it or they're using like dated information
Yeah.
about people who have Down syndrome.
Hmm.
People who have Down syndrome are just thriving so much. They've also benefited from advancements in medicine. They're living longer.
Hmm.
They have access to treatments and the research is getting better, even though, we still don't really know why it happens. We know what happens, we just don't know why. Um, and so I think, kind of delivering it in a way that it makes it feel like it's like the worst thing that could happen.
Hmm.
Like you said, is a dishonor and kind of a disservice to parents because a lot of people don't feel that way. I won't say that it's easy because there are going to be a lot of speed bumps, but it really wasn't the I don't want to use that language, but for lack of a better term, it really wasn't the death sentence that
Yeah.
I was first given that it would be.
Right. Right. And and then that also goes into that stigma, like what I was saying with like the definitions and really the type, because syndrome
Mhm.
is different based off of each person.
Right.
And if we are not educated on the topic of a certain thing, we all assume it's all one same similar thing.
Yeah.
So when we look at the way that past data has shown Down syndrome to be, we have this preconception of like you said, that idea of a death sentence, that your child could not have a normal or happy childhood. Like it's going to be something that's going to be very wrong with it.
Yeah.
And that's unfortunately that part of that stigma that goes with it, that I think from what I was able to find, especially with the resources that you found, like things are improving in a way where there's more understanding, more acceptance, and also to eradicate some of that ignorance that was behind it because of the
For sure.
old research.
Yeah.
Um, when I was looking at some of the things when you were showing me the different types of Down syndrome, and I'll
Hmm.
put this in the notes because like you and I were talking like not a
Hmm.
whole 100% of an expert, but like
Yeah.
this is some things that I learned,
Yeah.
when you were talking about it. But there's different types of Down syndrome, like
Hmm.
what happens when chromes. I'm reading from our notes here. So when chromosome 21 breaks off in only one of the initial cell divisions, so some of the
Yeah.
cells might have 46, while others might have 47. Like there's a variation with these different things.
Yeah.
So I think when we look at the word syndrome, we have to look at it as like it's many different facets behind it. So
I think the key for people to remember, and I'm glad that you brought it up that way. And of course, yes, disclaimer: I'm not a medical professional. I'm just a mom who's been dealing with this for 6 years and living in the community of wonderful Down syndrome community that we have here. But you're right. Like this, the reason it's called syndrome is just because it's a set of conditions, and not every person with Down syndrome experiences it the same way. Yeah, there are
Mm-hmm.
some things that occur more than others. But for instance, a lot of babies who have Down syndrome are born with complex heart conditions. And while he did have what's called patenductus ariosis, which means the little hole in his heart that, where your mom is breathing for you, it
Mm-hmm.
closes up a couple days after birth. His didn't close up. So we had to close his up with a device. But, that's just, I think, one example of how this syndrome occurs differently in people.
Mm-hmm.
Um, and to your point about the types, so I'll break this down for you. Like trisomy 21 definitely is the most common type. And that's where the 21st chromosome just like duplicates itself
Mm-hmm.
across every cell in the body. Then we have the type that's called translocation. And so 21 attaches itself to another chromosome, and the total number of chromosomes remains the same, but there's still an extra copy of 21.
Mm-hmm.
And then there's mosaicism, which is another lesser common type. And this happens when chromosome 21 breaks off in like one of those early cell divisions.
Mm-hmm.
And so some cells have 46 chromosomes, some have 47. Um, and so, again, it happens differently. And I think part of the need for additional research is to, find out why. But yeah, I'll leave that to the embryologists and the geneticists.
Yes. Well, and I think I found two that were really, really helpful in two resources that were really helpful in breaking it down. They had infographics. I was like, this is
Hmm.
phenomenal. So I'll share those in the episode show notes. That way for folks, they can look more, see more and more in depth
Yeah.
on it. But to kind of pivot into a little bit more, when I was talking about like the different terminology was the right way that you put it earlier, breaking apart past assumptions. And one thing that's infuriating is a lot of, how can I phrase this correctly? Looking at somebody and assuming and saying that they have saying to yourself or to others that they have Down syndrome and correcting to establish person first empowerment.
Hmm.
And it wasn't until you had said that to me that we were talking about this that I was like, I actually didn't think about changing the narrative, the way that we
Yeah.
interpret things. And then like then I had said like, okay, this is something that like we've all done because that's like the perception of like
Sure.
how does someone appear to us. And I had to train myself to get out of that habit. And unfortunately, it was just because it was something that was taught to me. And I think by changing this does help kind of break that harm to also give those folks in the community that empowerment to be themselves and
Yeah.
actually be like, I'm an individual. I'm not the condition that I have.
Hmm.
Um, and so kind of going back into like not stereotyping folks to ensure that they have the same respect as another person would.
Yeah, I definitely agree with all of that. And I think that it is applicable across the entire community of differently abled people. And that, and I also will say, I think the language that people use and are comfortable with, just like anything else, is going to vary, right?
Yeah.
Some things people aren't bothered by. I think just for me, and maybe this is because I'm very much an empath, it's important to me to recognize the person first. And that's why I've
Yeah.
also adopted language like differently abled. There are a
Mm-hmm.
lot of things that people in all communities can do that others can't do. And we do that differently.
Mm-hmm.
Um, but I think framing it with the person first language is critical to actually recognizing the individual for who they are, breaking down those stereotypes. I think I shared this too. There are times when my son, his name is Aspen, by the way, he surprises me with certain things that he does. For example, his speech is delayed, um, so his expressive language is a lot less further along than his receptive language. So, it dawned on me one time that he was picking up on like context and sarcasm and things like that, because sometimes he'll give it back. And I'm like, but why would I think that that things that are going on in his mind are any different than an average 6-year-old? Sometimes I think it's just having that mindset. Again, because I've even had to stop myself of like, oh, he's not ready for that yet, or he can't do that yet, and then
Yeah.
he proves me wrong every time. So I think when we're open to that, then we can more readily see that in other people.
Mm-hmm. Mm-hmm. I do love that. Whenever he joins us on our calls, I love it because he's just so happy and I love when he comes over and he just hugs you and he's just hanging out with you. He's a fantastic little guy. I love him. He makes me smile every time we have our meetings. Um, so kind of like, let's close out talking about the healthcare segment. You had said you're recommending to see a specialist at a Down syndrome clinic. And if you wanted to go in depth on that, that would be fantastic.
Yeah, so I think as a parent, you have to recognize that they have higher risks for certain health complications, like diabetes, thyroid issues,
Mm-hmm.
hearing loss, vision issues. So when we made it a point to continue with the Down syndrome clinic here in Columbus at Nationwide Children's Hospital, which is phenomenal, by the way. Just having a specialist who can walk through all of those things and remind me as a busy mom, like, hey, you got to make that appointment to see the ophthalmologist. It's just important to keep on that schedule of screenings throughout their lives, because they do need to be seen by those specialists.
Mm-hmm.
Um, and additionally, in order to I think address the developmental delays. They'll need speech therapy, occupational therapy, physical therapy, just to, work on mobility issues.
Mm-hmm.
So I will say that having a specialist either at a developmental clinic or a doctor who's been seeing Down syndrome patients for a while and are, keeping abreast of some of the latest research is very important.
Mm-hmm. And it kind of also goes into our next little segment of talking about this, where they're going to seeing a specialist, is also talking about inclusive childcare. So this is something that I didn't realize how difficult and expansive it
Mhm.
was, and not in a way of me being ignorant, but like I, for some reason, thought there would be a lot more options. I guess if that's the right word for it. So talking about how childcare in the United States is a hot mess, for lack of a better word.
Completely unsustainable, the path that we're on right now. Yeah.
Yeah, yeah. And I also have to give the disclaimer. I do not have children. So like this is completely foreign to me and I'm not going to pretend that I'm wholly knowledgeable on it.
I mean, I think you said it at the beginning when you said a hot mess, because even for typically developing children, parents are just struggling with this. And one of the things that I took a look at in preparation for our talk today, just because, I'm also a data nerd, so I wanted to get some statistics. Um, and I took a look at, and I know that you'll share these links with listeners. But just taking Ohio, for instance, we have nearly 1 million kids who are of the age that they need childcare centers. So almost 70% of them who are under 6 have both parents who are working. We don't have enough workers to care for those kids. The ones we do
Mm-hmm.
have are not being paid enough. We don't have enough centers to like really cater to them. And then so you layer on top of that children who have special needs, whether it's medical conditions, Down syndrome, developmental delays of other types. And so just acknowledging for families, children who have those special needs, it's, I think, incrementally worse, because
Mm-hmm.
the demands that they have. So, if we don't have medical professionals who still don't understand everything about Down syndrome. Like we are expecting childcare workers who are, unfortunately poorly paid to
Mm-hmm.
try to keep up with this research as well, and then not to rely on outdated assumptions when they are assessing children as to whether or not their program is a fit for them.
Mm-hmm.
So, you have those things working against you. You have, sort of ignorance in how to include those children in child
Yeah.
programs. And so, because people don't have that information and they feel like they can't do it, you meet that resistance regardless of whether or not um, they have to. And so, I'll just underline that as well,
Yeah.
for any parents who may be listening and sort of wondering, it is the law. The Americans with Disabilities Act does cover childcare, and it doesn't allow for discrimination of children who have special needs in childcare facilities. So,
Mm-hmm.
um, there's that. They do have to comply with that, and so I
There's
think
a legal thing there behind this. Yeah.
right. It's the law, but it's just as parents, we do have to be aware of it too, because if you get that pushback from them,
Mm-hmm.
a lot of times you might just be tempted to say, okay, well, that won't work for my child. Well, wait a minute, there isn't really a substantial accommodation I'm asking you to make for my child. So it's a balancing act, and it's a knowledge and information game to some degree too. Even if parents could do it, I think financially you can't always like I'm not an early child care expert. I know a lot
Mm-hmm.
of things. That's not one of them. I like to leave that to the professionals. So,
Yeah. Yeah.
I think it's just better for children to have that socialization when they can.
Mm-hmm.
Everything that we can do to help parents who want to work, allow them to work and not have to make that choice, I think we'll be better for it as a society.
Mm-hmm. I wholeheartedly agree with that. Absolutely. So then actually, let's kind of like dive into I don't want to say this like the fun part, but like I really loved what the things that you gave me when I asked you, or what's important as your role as a parent, like that helps you get through, so that way you can support Aspen.
Mhm.
And the big thing was, staying mentally strong, your mental wellness, physical wellness, emotional wellness, and things like that.
Yeah.
So, what do you do? Like, what advice do you have for other parents that go through this? What do you do that you think would be helpful for others, essentially?
I would say the first thing is to ask for and accept help.
Mm-hmm.
Um, I am not good at that. I'm still learning that. And unfortunately for me, it has gotten to the point sometimes where I was really overwhelmed before I was sort of like, okay, I'm crying uncle. I need the help. Don't be like me. Ask for and accept the help. Recognize that you need that support and seek it out. So, even in spaces where you don't think that you could normally be that honest. Now, obviously, you have to judge whether or not and you reveal certain things and how far you can go, especially in the workplace. I feel like I'm super fortunate, that I have understanding people around people who have children or
Mm-hmm.
understand that family is very important, very rooted people. So I don't have that issue. And I think that if you are a person who recognizes that that won't be a deterrent for you to have some flexibility or asking for help, I say definitely reach out and go for that. Um,
Mm-hmm.
Having that village and that network is key. Um, and this is why earlier when we were talking about healthcare, I am just such an advocate of having a specialist if you have one near you, because I think that extends to other services. Those people are going to be keyed into what's going on in the community. So if you have like a Down syndrome community in your area, or if you don't, find one online, talk to other
Mm-hmm.
parents. There's so much sharing of information. And then one other thing it reinforces is just that I'm not doing this by myself.
Yeah.
Other people have walked this before. They have advice for me. They've like figured out all the things and they can say,
Mm-hmm.
hey, here's some things that you can try. I think that's really important. And then just sort of having people who get it.
Yeah.
Experience this also with some friends who have children who have an autism diagnosis as well. And there are just certain things that, when we all talk to each other, we're like, yeah, we get it. We get it when, we're like, oh, we have to leave the party early because we're all on sensory overload. Okay, bye. It's been great. So
That is really great.
yeah. But I think, it's prioritizing that self care, well being, the other obvious things, right? Eating well, sleeping, getting your exercise, remembering that as you become a parent, regardless if your children are neurotypical or neurodivergent, to make time for the things that you love to do, those things that you are passionate about, taking
Mm-hmm.
some time to yourself. Sometimes for me, it's a nap. I seriously, I know I told you this before. I tell people naps are my superpower. Like I do them very well. I love them. I call myself a gangsta napper, and it's real. Like
I love that so much.
it is so real. I don't know what it is about napping, especially if you can get one like on your lunch break or something in the middle of the day. It's just the most awesome feeling.
Mm-hmm. Mm-hmm. I used to do that for breaks when I was attending one of my colleges. I would take a nap in my car before my next class. I had 2 hours, 2 hour nap.
Yeah,
It's perfect.
it was
Two.
great, wasn't it? Yeah. So yeah, just finding ways to rejuvenate yourself because parenting is hard,
Yeah.
and parenting a child with special needs it's even harder. And I just think you need to try to keep yourself in top form.
Mm-hmm. Mm-hmm. When you were talking about having hobbies and passions, what's your favorite? What's your favorite hobby? Like besides sleeping, you can't say sleeping. No naps.
I know. Mostly creative stuff. So I write, bake. Um, I am I am a big fan of interior design too.
Oh,
Actually doing a refresh on a couple rooms in the house now, so that has me a little bit energized.
I love that.
But yeah, I do like to work out, like taking a great hike every now and again
Mm-hmm.
when I can get out. So yeah, just using those things to connect with myself. Um, I'm definitely a water baby. Being by bodies of water is like really refreshing for me too.
Mm-hmm.
So
Mm-hmm. I like all of those. We should, when I start, like, when I finally move, if that happens ever, anytime soon, when I finally move, I'll send you some things I'm thinking about for my rooms and, like, get your input. That would be
mhm,
fantastic.
I
I
would
would
love
love that.
it. Now be careful because I'm in my maximalist era. Like, yeah,
What?
yeah, all
Okay.
the colors and things. Yes, so
Oh, we got to talk about that offline. I can't, we can't expose everybody to that on the
yeah,
podcast.
yeah.
I'll make a note of it after we're done. But then, as we close on the things, so what is something that someone had said to you that changed your perspective on everything that we discovered that you discovered and what everyone now has discovered? What's something that has changed your perspective?
Um, so gosh, there's been so much, but I think one of the things most recently, so I follow an Instagram account. It's called We the Urban, started by Willie Green. He's a writer. And one of the things he shared was that there's happiness in letting go. And
Mm-hmm.
I think there are a lot of ways that you can look at it. But I think, especially as it relates to my parenting journey and my personal growth journey, I see it as like giving myself permission to move into a place where I am completely open to the possibility of what things are without having expectations.
Mm-hmm.
Mm. And I feel like I've been happier that way.
I wholeheartedly agree with that. There is an art in letting things go,
Mhm.
and it's also understanding that you don't have to be in control of everything. Thank you for coming and doing this with me this morning. I know it
Yeah.
was really early. Fantastic.